December 2019. In Wuhan, China, doctors notice something strange: pneumonia cases with no clear cause. Patients have severe respiratory symptoms but don't respond to standard treatments. By late December, hospitals are filling with similar cases. On December 31st, China alerts the World Health Organization to a cluster of unusual pneumonia cases. Nobody knows it yet, but a new virus has jumped from animals to humans. Within weeks, it will spread globally. Within months, it will shut down the world. This is the story of COVID-19, the pandemic that killed millions, paralyzed economies, and changed how humanity lives. Chinese scientists quickly isolated the pathogen, a novel coronavirus later named SARS-CoV-2. The virus causes COVID-19, short for Coronavirus Disease 2019. Coronaviruses are common, usually causing mild colds, but some are deadly. SARS in 2003 killed 774 people. MERS in 2012 killed 858. This new coronavirus seemed more contagious than SARS and spread before symptoms appeared, making containment nearly impossible. Wuhan, a city of 11 million, became the epicenter. Hospitals overflowed. Healthcare workers lacking protective equipment fell ill. Videos leaked online showing chaotic scenes: body bags, exhausted doctors, people collapsing in streets. On January 23rd, China took an unprecedented step. They locked down Wuhan completely. All travel was banned. Residents were confined to homes. It was the largest quarantine in history. But it was already too late. The virus had escaped. Travelers from Wuhan had carried it worldwide during the weeks before lockdown. Cases appeared in Thailand, Japan, South Korea, and the United States. On January 30th, WHO declared a public health emergency of international concern, their highest alarm level. Still, many countries hesitated to act, hoping the outbreak would stay contained in China. It didn't. Italy became Europe's first major outbreak. By late February, cases exploded in northern Italy, particularly Lombardy. Hospitals were overwhelmed. Doctors made horrific choices about who received ventilators, essentially deciding who lived and died. Morgues filled beyond capacity. Military trucks transported bodies. Italy imposed a nationwide lockdown on March 9th, the first in the Western world. Images of empty piazzas and deserted streets shocked the world. If it could happen in Italy, it could happen anywhere. Spain and France quickly followed with their own outbreaks and lockdowns. In the United States, the first confirmed case came on January 21st, a man who had traveled from Wuhan to Washington state. But testing was extremely limited. The virus was spreading undetected through communities. New York City became America's epicenter. By late March, hospitals were overwhelmed, ambulances wailed constantly, and refrigerated trucks served as temporary morgues. The city that never sleeps went silent. On March 11th, WHO officially declared COVID-19 a pandemic. The word pandemic hadn't been used for a disease since H1N1 in 2009, and not for something this severe since the 1918 Spanish flu. The declaration made official what everyone already knew: this was a global catastrophe. Countries implemented lockdowns, closing businesses, schools, and borders. Stay home became the global mantra. Streets emptied. Public transportation ran nearly vacant. Office buildings sat dark. Playgrounds were taped off. The world pressed pause. For the first time in modern history, human activity slowed enough that pollution levels dropped dramatically. Satellite images showed clearer skies over major cities. Wildlife appeared in urban areas. Nature reclaimed space, however temporarily. But the human cost was devastating. By April 2020, tens of thousands were dying weekly. Healthcare systems in even wealthy nations struggled. Personal protective equipment, masks, gowns, gloves ran short. Ventilators became precious resources. Healthcare workers worked exhausting shifts, risking their lives daily. Many contracted the virus. Many died. They were heroes fighting an invisible enemy with inadequate armor. The virus attacked primarily the respiratory system, but its effects were complex. Mild cases felt like a bad cold or flu. Severe cases caused pneumonia, acute respiratory distress, organ failure, and death. Some recovered quickly, others suffered long-term symptoms, long COVID, with fatigue, brain fog, breathing problems, and other issues persisting months or years. The virus was particularly deadly for elderly people and those with underlying conditions, but young, healthy people died too. The unpredictability was terrifying. Scientists raced to understand the virus. How did it spread? Respiratory droplets from coughs and sneezes were the main route. Touching contaminated surfaces was possible but less common. Later research showed airborne transmission, tiny particles lingering in air, especially indoors. This explained superspreader events where one person infected dozens at indoor gatherings. Social distancing became essential. Stay 6 feet apart. Avoid gatherings. Don't shake hands or hug. These guidelines violated fundamental human instincts for connection and comfort. Masks became ubiquitous and controversial. In many Asian countries, mask wearing was already common and accepted. In Western countries, particularly the United States, masks became politicized. Mandates sparked protests. Some viewed masks as prudent precautions, others saw them as government overreach. The pandemic exposed and deepened political and social divisions. The economic impact was catastrophic. Lockdowns shut businesses, especially restaurants, bars, gyms, theaters, and retail stores. Millions lost jobs. Unemployment soared to Great Depression levels. Governments rolled out massive stimulus packages. In the U.S., checks went directly to citizens, businesses received loans, and unemployment benefits expanded. Despite this aid, many struggled. Food banks saw unprecedented demand. Evictions loomed. Small businesses closed permanently. The service industry, often employing lower-income workers, suffered most. But some sectors boomed. E-commerce exploded as people shopped online. Delivery services thrived. Technology companies enabling remote work, Zoom, Microsoft Teams, Slack, saw massive growth. The stock market, after an initial crash, recovered quickly and reached new highs, benefiting those with investments while millions struggled. The pandemic widened wealth inequality. Education transformed overnight. Schools closed globally, affecting over 1.5 billion students. Teachers adapted to remote learning with varying success. Wealthy students with computers, internet, and parental support managed better. Poor students lacking resources fell behind. The education gap widened. Parents became teachers while working from home, adding stress to already strained households. Children missed socialization, sports, and activities crucial for development. Social isolation took a toll. Humans are social creatures. Months of limited contact caused loneliness, anxiety, and depression. Mental health crises surged. Domestic violence increased. Substance abuse rose. Suicide rates climbed in some places. Video calls and social media provided some connection, but screens couldn't replace human touch and presence. Yet there were moments of beauty. Communities came together virtually. Musicians performed online concerts. Museums offered virtual tour. People clapped from balconies and windows, honoring healthcare workers. Neighbors helped neighbors. Volunteers delivered groceries to vulnerable people. Human resilience and kindness shone through darkness. The pandemic exposed existing inequalities. In the U.S., Black, Latino, and indigenous communities suffered disproportionately higher infection and death rates. They were more likely to work essential jobs with high exposure, live in crowded housing, lack health insurance, and have underlying conditions from environmental and social inequities. COVID-19 didn't create these disparities, it revealed them brutally. Globally, wealthy nations secured vaccines and treatments while poor nations struggled. Vaccine nationalism, countries hoarding doses for their populations, left developing countries behind. Whose COVAX initiative attempted to distribute vaccines equitably, but wealthy nations' procurement left little for others. The pandemic reminded us that in an interconnected world, disease anywhere threatens people everywhere, yet global cooperation remained insufficient. Scientists worked at unprecedented speed to develop vaccines. Normally, vaccine development takes years, often a decade or more. Multiple COVID vaccines were developed, tested, and approved within a year, a scientific miracle. This speed resulted from massive funding, parallel rather than sequential trials, and years of prior coronavirus research. The mRNA vaccines from Pfizer BioNTech and Moderna used revolutionary technology, teaching cells to produce a harmless piece of the virus's spike protein, triggering immune response without using live virus. The first vaccine was approved in the UK in December 2020, less than a year after the virus was identified. Vaccination campaigns began immediately. Healthcare workers and elderly people were prioritized. Countries competed to vaccinate populations fastest. Israel led initially, vaccinating most of its population by spring 2021. Other wealthy nations followed. The vaccines were highly effective at preventing severe disease and death, though protection against infection, especially from variants, was less complete. But the virus mutated. New variants emerged: Alpha, Beta, Gamma, Delta, Omicron, and others. Some spread more easily. Some partially evaded immunity from previous infection or vaccination. Delta, dominant in mid-2021, was far more contagious than the original strain. Omicron, emerging in late 2021, spread even faster but caused generally milder disease. Each variant wave brought new infections, though vaccines significantly reduced hospitalizations and deaths among vaccinated people. Vaccine hesitancy became a major challenge. Misinformation spread online, claims that vaccines were unsafe, contained microchips, altered DNA, or caused infertility. These falsehoods, amplified by social media algorithms and some public figures, convinced many to refuse vaccination. In the U.S., vaccination became politically polarized. This hesitancy prolonged the pandemic, allowing continued virus spread and mutation. Public health officials struggled to counter misinformation while respecting individual choice. Booster shots became necessary as immunity waned and variants emerged. Initially, boosters were controversial. Some argued unused doses should go to unvaccinated people in poor countries rather than boosting vaccinated people in wealthy ones. Eventually, most countries recommended boosters, especially for elderly and vulnerable populations. Treatment improved dramatically. Early in the pandemic, doctors had few tools. Hydroxychloroquine and ivermectin, despite some public figures' promotion, proved ineffective. Supportive care, oxygen, ventilation, treating secondary infections was the main approach, but research identified effective treatments. Dexamethasone, a cheap steroid, reduced deaths in severe cases. Monoclonal antibodies helped high-risk patients. Antiviral pills like Paxlovid reduced hospitalization risk. Combined with vaccines, treatments dramatically reduced COVID's death rate. Countries adopted different strategies. China pursued zero COVID, using strict lockdowns, mass testing, and contact tracing to eliminate outbreaks. Initially successful, this approach became unsustainable as more contagious variants emerged. Prolonged lockdowns sparked rare public protests. China finally abandoned zero COVID in late 2022, leading to a massive infection wave. Sweden took a different approach, avoiding strict lockdowns, keeping schools and businesses open, and relying on voluntary measures and public health guidance. Results were mixed. Sweden had higher deaths than neighboring Nordic countries, but less economic damage and fewer restrictions social costs. Most countries fell between these extremes, implementing temporary lockdowns, mask mandates, capacity limits, and vaccine requirements, adjusting measures as infection rates fluctuated. These policies' success varied based on compliance, public trust, healthcare capacity, and population density. The pandemic accelerated existing trends. Remote work, once rare, became common. Many companies realized employees could work effectively from home, leading to permanent hybrid arrangements. This enabled lifestyle changes. people moved from expensive cities to cheaper areas, spending more time with family. But remote work wasn't possible for many. Service workers, manufacturers, construction workers, and others had to work in person, often at greater risk. Telemedicine expanded dramatically. Virtual doctor visits, previously uncommon, became routine. This improved access for some, particularly rural residents and mobility-limited people, but created barriers for elderly or technology-inexperienced people. The pandemic changed social norms. Handshakes became rare. Hugging and kissing greetings decreased. Personal space expanded. Wearing masks when sick became more acceptable in Western countries. Discussing health conditions became less taboo. Some changes may be permanent, others will fade as the pandemic recedes from memory. Political consequences were significant. Leaders who handled the pandemic well, following science, communicating clearly, showing empathy, often saw approval ratings rise. Those who downplayed the virus, ignored experts, or prioritized politics over public health faced backlash. The pandemic influenced elections worldwide. In the U.S., many analysts believe Donald Trump's pandemic response contributed to his 2020 electoral defeat. Conspiracy theories flourished. Some claimed the virus was a bioweapon deliberately released. Others denied the virus's existence entirely, calling it a hoax to control populations. These theories, though baseless, gained traction online and even among some government officials. The infodemic, an epidemic of misinformation, complicated pandemic response and eroded trust in institutions. By 2023, the acute emergency phase ended. Most populations had hybrid immunity from vaccination, infection, or both. The virus became endemic, circulating constantly at lower levels rather than in distinct waves. Deaths decreased dramatically. Hospitals returned to normal capacity. Mask mandates ended. Travel restrictions lifted. Life resumed something resembling normalcy. But normal was different. Office buildings remained partly empty. Zoom meetings persisted. Online shopping continued growing. Many people remained cautious, especially immunocompromised individuals for whom COVID remained dangerous. Long COVID affected millions, causing chronic disability. The mental health crisis continued. Trust in institutions, government, media, science remained damaged. Political divisions deepened. The pandemic's scars, physical and psychological, will last generations. The final death toll remains uncertain. Official counts exceed 7 million globally, but many deaths, especially in countries with poor surveillance, went uncounted. The true toll likely exceeds 15–20 million. Every number represents a person, a parent, child, friend, mourned by loved ones. The grief is incalculable. What did we learn? Pandemics remain existential threats. Global cooperation is essential but fragile. Public health infrastructure requires investment. Scientists can achieve miracles with proper support. Misinformation is dangerous. Inequality kills. Essential workers deserve better pay and protection. Remote work is viable for many jobs. Society can change rapidly when necessary. And humans, despite everything, are resilient. The pandemic also showed what we failed to learn or apply from previous outbreaks. Many countries had pandemic plans that were ignored. Early warnings were dismissed. Experts were sidelined. Politics interfered with science. Nationalism trumped cooperation. We repeated mistakes from 1918 despite a century of medical advances. Yet there's hope. Vaccine technology advanced dramatically. mRNA vaccines can now be developed rapidly for other diseases. Global surveillance systems improved. Research into coronaviruses accelerated, potentially preventing future pandemics. We tested our systems and, despite failures, learned valuable lessons, if we choose to remember them. The COVID-19 pandemic will be studied for generations. It was a crisis that affected everyone on Earth simultaneously, unprecedented in modern history. It revealed humanity's strengths and weaknesses, our capacity for both innovation and denial, cooperation and division, sacrifice, and selfishness. For those who lived through it, certain images remain burned into memory: empty Times Square, refrigerated morgue trucks, Zoom calls replacing family gatherings, masked faces everywhere. The first vaccine injection bringing tears of relief and hope, the moment restrictions lifted and strangers smiled at each other again. The pandemic reminded us that we're not as separate as we think. Borders couldn't stop a virus. Our fates are interconnected. Actions in Wuhan affected lives in Wuhan, New York, Mumbai, Sao Paulo, and everywhere else. In our globalized world, we're all vulnerable to threats that don't respect boundaries. It also reminded us what matters. When life was stripped to essentials, people valued health, family, and community over wealth and status. Essential workers, nurses, grocery clerks, delivery drivers, sanitation workers, were recognized as truly essential, even if compensation didn't reflect that recognition. The pandemic is not over. COVID continues circulating, still killing people, particularly the vulnerable. But the acute crisis has passed. We're learning to live with COVID as we do with flu and other endemic diseases. Vigilance remains necessary. Future variants could be more dangerous. Another pandemic is inevitable eventually. The question is when, not if. From a wet market in Wuhan to every corner of the globe, COVID-19 became the defining event of the early 21st century. It killed millions, disrupted billions of lives, crashed economies, accelerated technological change, and altered society in ways still unfolding. Future historians will mark time as before and after COVID, just as previous generations marked before and after world wars. We survived. Humanity persists, but we bear scars: physical, economic, psychological, social. The world that emerged from the pandemic is different from the one that entered it. Whether we're wiser remains to be seen. The true test is whether we learn from this catastrophe and prepare better for the next one. Our survival may depend on it. The empty streets filled again. The masks mostly came off. Life resumed. But those who lived through it will never forget when the world stopped, when a microscopic virus humbled humanity, and when we were reminded that despite all our technology and progress, we remain vulnerable to nature's ancient threats. COVID-19 was our generation's defining crisis. How we remember it and what we learn from it will shape our future.